The new Chase Farm Hospital was opened in 2018 as a new state-of-the-art facility. In 2022, it gained a HIM7 digital recognition, one of only 10 hospitals in the world to gain this recognition, of which we're extremely proud of. The site provides a whole repertoire of digitally integrated services. These really affect patients, and we hope that they can feel that right from the moment they walk into the hospital, right through to their discharge.
On a weekly basis, we see about 3,500 patients. It varies from medical to surgical specialties. So when patients turn up for an appointment, don't have to line up in a queue. They have their appointment letter with a barcode in it. They'll scan it in one of our self-check-in kiosks. They will see on the screen the information on where to go. We always have friendly members of staff and patient volunteers to help make the patient feel comfortable while waiting for their appointments. We'll flash your name with a room number where your clinician will see you. With our advanced digital system, it's easier to monitor the patient flow, who's been seen or who's not been seen yet. I would hope patients feel that they're well looked after and given the best possible experience.
The Urgent Treatment Centre is here for our local patients that are presenting with new minor injury and minor illness needs, hopefully reducing the pressure on our local A&E departments. They should be triaged within sort of 15 minutes of arriving and seen and discharged within 2 hours. I think one of our greatest strengths is just we have a really mixed team of professionals from all sorts of backgrounds, from sort of acute emergency departments to intensive care to the ambulance service and the community as well. So we hopefully have a team with a real sort of wealth of experience for anything and everything that might present.
Whilst the Urgent Treatment Centre provides that critical service for the local population, Chase Farm's also able to fulfil a much larger role that's way beyond its footprint, and its impact is actually felt throughout the whole sector as being one of the new surgical hubs. This means that we're able to do operations for other North London hospitals without the interruptions of emergency surgery that you have in acute hospitals. We've got 8 operating theatres here in total, and we are one of only 4 hospitals in the UK that has a barn theatre.
It's a large space where there are no physical walls between operating areas. Just behind me, my registrar is completing the operation that I just started. In front of me is an orthopaedic list. So in full flow, there will be 4 operating spaces within the barn.
There are days of the week where we have similar types of surgery in here, so consultants and registrars can all work together. There's shared learning. It allows that concentration of clinical expertise from not only within our trust, but from other neighbouring and partnership trusts. We also have lots of digital integration. There are 4 laminar flow hoods, so the air in each theatre space changes every 20 minutes completely, so there's no aspects of infection going from one theatre to the next. We have Genesis, so we can have patient-level costing and we can see exactly what's been spent in theatres to make sure that's efficient. We're also able to reorder all of the items used that day automatically. So having this environment really does help get patients through the system quickly and efficiently. Our elective surgical patients are looked after on our surgical ward, where each patient has their own individual room, which really adds to the patient experience.
Our ward is 50-bedded. We have 42 single rooms. So they have their bathroom in there, TVs as well. We always emphasize for the patient to press the buzzer whenever they need help, and then we'll get a notification straight away.
We have a very sophisticated internal ASCOM communication system that allows patient deterioration alerts to be transmitted throughout the hospital to the right members of a resuscitation team or for local escalation.
The system is just impeccable. If you want to get hold of a doctor, just with the ASCOMs, you ring them, they'll be with you.
Digital integrations can really benefit patients' experience and quality and safety. So, an example would be our electronic patient record, whereby clinicians from different locations can seamlessly have access to your records, for instance, see your blood results, see your radiology results.
We also have a fantastic system of patient scanning that enables you to give the right medication to the right patient at the right time as well.
Every patient that steps through that door, they're very anxious. And it's about reassuring. Our team is very good at that. Reassuring them, take them in, say, we're going to look after you. This is your room with their own private toileting facilities. When you take care of their privacy and dignity, they're relaxed and they just get on with it. We've got 5 state-of-the-art procedure rooms with great equipment. We see anywhere from 40 to 70 patients a day. But at the same time, it's about creating that pathway that it doesn't seem rushed, and our patients do appreciate that. I'm so exceptionally proud to provide a great care for our patients.
This is Hematology Oncology Day Unit. This is a specialist nurse-led unit. It's only here that chemotherapy can be administered. We also do blood transfusion, supportive care, platelet, immunoglobulin, iron infusion. We tend to see up to 60 patients a day. All the chairs are recliner chairs. Each has quick screen to protect confidentiality and privacy. The Royal Free Charity has provided patients with the VR headset, so when they're having the treatment, they will see different world that will give them distraction. Sometimes they feel overwhelmed with the treatment, but the calming nature of the staff makes them feel safe.
One of the things that we've learned is the need for our services and our infrastructure especially to be adaptable. Not only are the internal spaces all reconfigurable, even externally the building is designed in such a way that it will accommodate extra capacity up to 15,000 square feet. Chase Farm is a fantastic place for both patients and for staff.